All right, so thanks for allowing me to discuss this paper. It's a really interesting paper. I think the most exciting aspect of the paper is the discussion of this data set, which is an administrative records data set that covers a part of the age distribution which is not covered very well in any other data sets that economists use if you're interested in thinking about what the impact of the onset of a health condition that affects work, that affects your ability to work, how that affects your transitions into these various programs that Amal was talking about. And I also credit these non-economists to come in and talk about this in a room full of economists. That's always a difficult thing to do. I think that in the way that they approach this matter, it's quite different than the way an economist would approach it, in the sense that it's somewhat atheoretical. They're looking at all of these trajectories, and they're using a statistical technique to identify similarities in these sequences, create these clusters, and then in the end look at the four key clusters, and then make some comments about the characteristics of the kinds of people who fall into these four sets of states that they talk about. I have to say that what I'm about to say may or may not be relevant, because I'm not sure whether in the paper it was unclear exactly what the relationship, how it was that you became eligible for for a short-term disability and eligible for marital leave sorts of things. So I'm going to suggest something which may be completely wrong, and I think I heard in the conversation today that I could be wrong about this. So anyway, I'll tell you the story which was amusing to me, and I could be completely wrong on this. So let me start by saying that I was trying to think of a way to talk about this paper that would be relevant to the rest of us in the room. And I think the thing that struck me about the paper is, what do you do when you get a data set that you don't control? That is, it's an administrative records data set that you haven't developed. What is it that's actually in that data set that will allow you to answer important questions? And I was thinking of a case study in archaeology where this could be explained. So the case study is Indiana Jones and the Last Crusade. And there are two important lessons learned from Indiana Jones and the Last Crusade. One is in terms of, for junior faculty members, if some guy comes into your room, a very senior professor, and he has short hair follicles up here, but a pretty nice beard, and tries to convince you to get into a research project with him to find his holy grail, maybe a junior person should actually want to be involved in that research. But there's a downside to that, because then you might find yourself in a position where you have to make a pretty difficult decision about whether this is the holy grail or it's not. And there are major downside consequences if you're in error about this. So the way Professor Jones figures this out is to ask himself, who produced this holy grail, and why did he produce it? And he figured out from that this was a carpenter, and a relatively poor carpenter. So this holy grail that was made of wood seemed like a good bet for the holy grail rather than all these other aspects of that. So what I would suggest to you is where this comes in terms of thinking about the administrative data that's in here is to ask yourself, who put it together and why did they put it together? So I think the answer to that is the HR department put this data set together because they were interested to know, for profit motives, exactly where their workers are, so they needed to know why they were not at work, why they were absent. And it had to be related to liabilities related to the firm in terms of state and local and federal laws regarding the treatment of different people who experience the onset of a disability. So the context of this data set is one that should be thought about in the context of what these managers in HR are worried about. The first is state workers' compensation rules, and there wasn't much of a discussion of workers' compensation in the paper, but workers' compensation is important for firms because they're on the hook for paying out for workers who experience a partial, total, short-term, long-term accident, injury, health condition that's related to the job. So that data is very interesting in terms of what firms might do given that a worker's absence because of workers' compensation issue. The second is that only about 30% of workers in the United States are in jobs that are covered by private disability insurance. But in Alcoa's case, all of these workers are covered. And now we're talking about partial, total, short-term, long-term coverages of disabilities regardless of the source of income. So this is a different mechanism that you're going to use to provide benefits for them. You're going to provide benefits even though the condition is not necessarily job-related. And then finally is Social Security Disability Insurance, which is a total long-term, covers disabilities regardless of source that most workers are covered for. And it turns out that you're very interested in knowing who goes on to the Social Security rules. And one of the things that wasn't mentioned but is in the paper is that in order to get on to the long-term disability program at Alcoa, you have to agree to apply for SSDI benefits. Now, why would firms be interested in doing that? Well, the answer to that is if you can get your worker onto the disability rolls, a dollar for dollar offset to your payment of that long-term disability benefit. So what I was thinking about when I thought about this way of thinking about this data is how really interesting you could how you could use this data in an interesting way to see what happens after the onset of a disability, which there's great health data here to do this, and then to see how people sequence through the short-term disability program, either on workers' comp or not on workers' comp, and then to the long-term disability, and then prepare themselves to get onto the SSDI program. Okay, so that's what I was thinking about. Economists have spent, what time we've spent on this issue has almost all been on the back end of the life cycle with regard to moving out of the labor force and onto the SSDI roles. And there's a serious problem with that. It's hard to argue that the United States workers are becoming sicker or experiencing more accidents, but in fact the SSDI benefit rolls have increased from 500,000 to over 9 million between 1960 and 2012. If you look at disability recipiency rates in the United States, that is the number of people on the DI rolls versus the working age population, you see a consistent increase in that after there's a rise in the 70s, it's flat in the 80s, and then since 1990, a substantial increase in that ratio, whereas in 3 other countries, all of whom have had problems with growing ratios over time, they've implemented major policy reforms that have reduced that recipiency rate. So it suggests that maybe something needs to be done with regard to our DI program. But the problem is that, and a really nice example of why this is true is a terrific paper by Mastis, Mullen, and Strand in 2013 AER that uses variations in the decision-making of particular Social Security agents, gatekeeping agents. And what they do is they look at workers who have similar health conditions but have, by the luck of the draw, either a hard evaluator or an easy evaluator, and show that 23% of all initial applicants are marginal entrants. They either come on or don't come on because of the attitude of the person who's making the judgment about whether they should get on benefits or not. So why is this important? It's important because now they have a control group and a treatment group, and they show that entry onto the SSDI program reduces employment by about 21 percentage points. And for less severe and impaired, it's 60%. For for more severe, only 10%. The point is there's a lot of residual work possibilities way out at the end of the process. So if you want to do policy reforms, you don't want to start doing it after people come on board on a DI program, but rather much earlier. So two papers that, one written by Otto and Duggan for the Brookings Institution, one by myself and Mary Daly, are strategies for controlling the movement onto the rolls is one to put more pressure on the employers by making them bear more of the costs so that fewer people will come onto the rolls. This is the kind of data set that can actually show you what's going on several years before people apply for disability. And in my work using HRS, it's about 7 years between the time that you become, have a event, a history, a health event, and the time you apply for benefits. Okay, so what does all this have to do with Harrati and Cullen's work? Alcoa administrative records from January, we talked about this, they have 17 years of really interesting data in which they can do longitudinal information on people, 26 plants in 15 states. They talked about the 5 possible states: employed, absent due to short-term disability, absence due to long-term disability, on leave, family leave, and then they left Alcoa. They have information on workers' comp, which they haven't made use of, but could be used in this way. And then they talk about characteristics of the firm. They talk about, in this presentation, talk about hourly wage rates and W-2 forms and all that, which is really exciting, but they don't use that at this point in the paper. What's really great about this data is the medical record stuff, the risk scores, the outpatient hospitalization. I think with those data, you could actually pinpoint when this event that we're talking about actually occurs, and you could start with that and move forward. Okay, so as we just talked about, they take this, use this cluster analysis to get these trajectories, and then key results are in table 4. So let me get to table 4 and let me show you in a simpler way what they find and why I have some questions about whether they're properly using the data, but we'll see whether this works out or not. So they find that when you're looking at people who go from work to termination with no movement on to the short-term or long-term disability rolls, that's about 68.8%. That says that over 30% are actually experiencing over their lifetime at least one short-term disability event. And then they find, in fact, that 16.8 are experiencing up to 2 separate short-term disability events, which are separate. They're not part of the same thing. 10.9 have this disruptive work. It's really hard for me to unpack what's going on in this disruptive work because it's sort of more than 2 STDs or a movement containing an STD plus an LTD. But then they talk about the 4th sequence, which is the one that makes a lot of sense to me, moving right from work to long-term disability. That's about 3.6%. So can it really be the case that over 30% of workers at Alcoa are experiencing these kinds of fairly substantial movements onto the disability rolls, even the short-term rolls? And my suspicion is possibly not. What makes me suspect this is that in their actual table 4, although they said a little bit differently here, there is a significant difference based on gender and for short-term disabilities, and it's 60% more likely to be associated with a short-term disability than men, 180% more likely to be associated with a disruptive work than men, but only a third are as likely to be associated with long-term disabilities. So here's my question, and maybe I'm wrong on this. There's a tremendous difference between being on leave based on the Family Medical Leave Act of 1993, which is unpaid leave, and being on leave because of pregnancy, which I believe is an STD. So it wasn't clear in the paper whether you had, in fact, accounted for the STDs that are based on pregnancy. If you have, then I'm completely wrong on this. But if you haven't taken care of it, then that's one explanation why you're finding so many, that women are more likely to experience these short-term disabilities and what you call the mixed business. If that's the case, then you need to account for that. And it's sort of pregnancies are really interesting. It is legally, it is an STD, but it's an interesting one, and it's one that you quickly recover from. And it would be interesting to compare those women who, in fact, experience these STDs and look at that as a case of what happens over the rest of their lifetime versus people who have STDs that are based on other things in which there's less likely to be fully recovered. So, and then just the other point that makes it into the world of difference in difference kind of analysis. You have 5 states that have mandatory STD programs. California is one of them, and there's a major presence of Alcoa in California. I have no idea whether Alcoa has the same rules across all states, or whether those, or Alcoa's treatment of their workers is based on state and federal rules, and you have some variation now because of those different states. Okay, so next steps. If I were doing this, I would trust my instincts more in terms of the way I see the key transitions. I'd go into event history mode. I'd pin down the onset of a health-based event, and then I'd show the risk of moving from that health-based event through the system, through WC for the private disability system, long and short, and then to the SSDI over time. And the other thing I'd do is, if I'm right that there's differences in the way Alcoa treats its workers depending on the states that they're in, I'd kind of look at what's going on in California, where they have this mandatory short-term disability plan, and in Texas, where we don't have any of that stuff. So I will end there.